Now, there are claims that there's been a huge breakthrough in the treatment of heart attack problems. Doctors in the US have discovered that scar tissue surrounding the heart could be halved using patients' own stem cells. 25 people were involved in a trial which inserted the stem cells directly into the arteries around the heart. Now, joining us in the studio now is Dr. Iqbal Malik, a consultant cardiologist at Hammersmith Hospital here in London. Thank you very much for coming in. And explain to us then what's so wonderful and how much of a breakthrough this is then.
Well, I think this study really was a safety study, so I'm not really sure how much of a breakthrough it is. Stem cell research has been going on for quite some time. We can find the stem cells as they did by taking a biopsy from the heart and then culturing that biopsy sample. You can get it from peripheral blood cells, take them out of your own blood and then grow them up and then inject them back, or you can get them from bone marrow. So they've taken the idea of taking a sample of heart tissue from that patient and then injecting it back in again down the blood vessel that used to be blocked and seeing if something happens. The main purpose of this study actually was safety. Previous trials have ended in a bit of a disaster because rhythm disturbances have occurred and the patients have even died.
But it does underline the significance, the real importance for our age of stem cells, isn't it?
It does. I mean, so I think stem cell research is here to stay, and every big discovery is taken really in small steps, and this is one small step trying to define the safety. Before we can say this is really an important breakthrough, you have to go beyond 25 patients to really big trials, and that involves not the endpoint of looking at any one measure, a number on a scan, but actually prove that patients live longer, and so we're some way away from that.
But the real breakthrough, if indeed there has been one, has been the fact that they've established that you can get a certain amount of muscle activity, if you like, once using this treatment that they've devised in the US, and that seems to be something that they're very excited about.
Well, I mean, it is interesting, but again, I'd counsel that we've had drugs which have increased the heart pump function and made it look better, with a slightly dramatic downside that the patients actually also died with that. So it's not treating that number, and I say again that probably the best measure would be not that number, but actually survival overall. So although it's exciting, and I think it's worth pursuing that track, as indeed we are in the UK as well, we're quite a long way away to having this in your local hospital.
So in the meantime, advice remains the same as to how we should avoid or prevent ourselves having a heart attack. What's the advice?
Oh my goodness, absolutely. So prevention is definitely better than cure, and so we can do ourselves a favour by not smoking, focusing on our diet and taking cholesterol tablets if they're recommended, and then we have to work in tandem with the ambulance crews to make sure that if you do have a heart attack, you call the ambulance early and get yourself into hospital, because unfortunately the majority of patients with heart attacks still die before they get to hospital. Once they're with us, we can help them, but we can't help them if they're not there, and we certainly can't give stem cells if they've died outside hospital.
Oh dear, no, not such a breakthrough then. Dr. Iqbal Malik, thank you very much indeed for coming in and talking to us here at Impact. Now, hearts are rejoicing in Peru at least, of course, because it's Valentine's Day.